Well, of course, it is a fun time of year with the holidays, but it's also a very important time of the year when it comes to healthcare. As many of you know, open enrollment happening right now. We have till December 7th to make sure you are enrolled. And we thought we would visit with our friends at WellCare. Specifically, Dr. Alan Smith is going to join us again to talk about some of the basics, most important, how you can save money, keep your out-of-pocket medical costs low, and still be able to get great care. Dr. Smith, how are you?
Good. Thank you for inviting me.
So we're glad to chat with you because, you know, there's so many terms and healthcare can be so overwhelming. And so let's kind of go down to the basics, if you will, and let's first dive right in. Medicare, what do people need to know? What is it all about? And most importantly, who does it affect or who can qualify?
Sure. Good question. So Medicare is the federal health insurance program for people 65 and older, but it also can be covered for certain people with disabilities who qualify for Medicare as well. And the annual enrollment period runs now through December 7th, as you mentioned. So this is the time for people to consider whether they're eligible for a Medicare plan and what will best meet their health needs for 2021.
And when you're talking Medicare, then you also hear Medicare Advantage. What does that mean?
Right. So the difference is there's original Medicare, which offers Part A, which covers the hospital and like nursing home, and then Part B, which covers outpatient care and your doctor's fees. And then there's even a Part D for prescription drugs, which doesn't come automatically with original Medicare, but you can purchase that separately. And then you can choose any doctor that takes Medicare, but you may have considerable out-of-pocket expenses. So the other option is Medicare Advantage, which is provided by private insurance companies. But the advantages are they give you your Part A and your Part B, and they give you the Part D, which is the prescription drug coverage all wrapped together. And they usually have lower out-of-pocket expenses, so they may have little or no monthly premiums. And for the prescription part, they may have little or no payment on generic drugs. And then also there are other benefits that you want to look for. For example, they may have vision, dental, and hearing benefits that are not in original Medicare.
So I'm going to use my parents as an example as a guinea pig here. My parents recently turned 65, 66, so they're in that age group. And I tell you what, they get so much mail each day about different options that they can sign up for, completely overwhelming. What are some of the important things to consider when choosing a Medicare plan that's right for you?
Right. So good question. And it's really important. So one is coverage. So you want to make sure that your doctors are in the network of the plan you're choosing. So, for example, your primary care doctor and then also your specialists, have you used a certain hospital or outpatient center? Check to see that they are in the network. And then also think about, are there any services or procedures that you might need in the coming year, and make sure they're covered as well. Then the second thing is added value. So besides hearing, vision, and dental benefits, you want to think about other things. For example, WellCare provides free fitness memberships and free transportation to your doctor's visit and to the pharmacy to pick up your medicines. In-home support services like household chores and meal preparation. There are annual allowances for over-the-counter benefits. So, for example, Band-Aids and toothpaste and things that you think are, they're good for your health, but they're not medicines. And flex cards, which are prepaid debit cards that may help cover out-of-pocket expenses. And then lastly, think about COVID-19. So it's scary, and the vaccines will be coming, but they're not quite out yet. And so does the plan you choose offer benefits to help you stay healthy at home? So for example, WellCare will provide for telehealth. So telehealth is that you can do your visit with your doctor from home. So if you have a cell phone, it's a smartphone, you can be hitting a link and talk to your doctor right on your phone. And the doctor sees you and you see the doctor. The doctor can electronically transmit prescriptions to the pharmacy, and you didn't have to leave your home. So telehealth is something to look for, as well as some plans will offer free monthly memberships to grocery delivery like Shipt, and also sometimes monthly allowances for certain foods and essential items. So look for these added benefits.
And I'm really glad, too, you touched on WellCare and some of those added benefits that you can provide in those. What can people do? Where do you want to send people for more information if they want to look into what WellCare and how they can help them?
Sure. Well, you can go to www.wellcare.com enroll wellcare.com and get more information. There's also government websites as well. But the key is to remember that the open enrollment period ends or goes through December 7th. So you want to do it soon. Talk to the family over Thanksgiving and then make a decision.
Dr. Smith, we appreciate your time today. Thanks for being with us. Again, December 7th, that's the important date. Take care, okay?
All right. Thank you for inviting me, and stay well.
You bet. You too.